Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Well, hello, everybody, and welcome to another Action on Pain podcast. I am Virginia McIntyre, and joining my lovely co-hosts, Jennifer and Keith. Today, we welcome Dr. Arun Radhakrishnan. He is a family physician with a focus on clinical practice and chronic non-cancer pain. Arun has many accomplishments and roles, but today we're going to narrow it down and talk about mentorship networks and the area of digital health with chronic pain. So we are very happy for you to take your time with us today.
Excellent. Thanks, Virginia. Always great to be back in the studio with you two fine folks. Really looking forward to today's conversation. Two areas that are really important, and one that I know very little about, which is the digital health. So if we get a chance to delve into that, I'm really excited to learn more about that.
Awesome. And my name is Jennifer Daly-Cyr, and it's such a true pleasure to welcome our guest today. Actually, Arun and I sit on Pain Ontario board together, and we've crossed paths on a number of projects. So it's really such a pleasure for you to take your time with us today. Thank you so much.
Thank you for having me here. Very excited.
Excellent. So we're going to jump right into this. As Virginia said in the opening here, we have two areas of focus. So we'll touch on both, and then we're just going to explore all of this with you, hopefully in the time that we have. So we're very interested to learn about your work in the mentorship network. It's something that we know is very important. So we'd love to have you talk a little bit about the work that you do, why you got into that, exactly what your role is, all of that great stuff. And then if we have time, really would like to touch on your work in the digital health. I know I did some research on you. You have a master's degree which kind of focused in on some of this. And I think we can agree sort of digital health and those kind of tools are the wave of the future. So lots to talk about, but let's first start with your work in mentorship networks. What do you do? What does that mean? Why do you do it?
Great question, Keith. I'll jump off where you started off with, which is around my master's degree and digital tools. That was exactly it. My master's degree was doing a health services research master's at the University of Toronto, where I was looking at how digital tools could support innovations in the domain of chronic pain. And so stumbled upon the mentorship networks that time. And that was how I got involved in these networks to start with, was sort of really engaging with them, learning about them, analyzing them, and then really trying to explore and understand how various digital platforms and tools could support activities within that mentorship network. So that's how I got started. And that was probably 15 odd years ago at this point in time. So I got involved with the network that was present in Ontario at that time, focusing on mental health, substance use, and chronic pain. And also got involved with the network in Nova Scotia, which is the AMN, so Atlantic Mentorship Network, Pain and Addiction. And so got involved with those two programs, and sort of really, that's where my sort of interest and focus has really blossomed from there.
So when today you're getting involved with these networks, so just to clarify a little more, so is your role to kind of more support them in outcomes of the network and how digital health can support them better than be a mentor yourself?
Yeah, great question. I've kind of gone through the whole spectrum of work in those networks, right? First, I started as an external person studying those networks and how digital tools could work. I then became a mentor in those networks and was helping to support them as well. And then eventually where I am right now, which is helping to develop these networks. So if we take a look right now, my work, and I think, Keith, this goes back to the question you brought, which is, well, what am I doing now? Well, my work really is on how do we foster and build these networks in different regions of the country. So currently we have mentorship networks in Newfoundland. We have a network in Nova Scotia, Prince Edward Island, New Brunswick. We have a network in British Columbia that are focused on chronic pain, substance use, and mental illness, as looking at those three clinical domains. And so my work then is to help build these networks, help foster their growth and development, and then also see if we can build new networks in new areas as well.
So that is very interesting. And just to tie this to the amazing action plan, the work you do in the mentorship networks really, we think aligns with that goal number 3. And what's interesting for me is we hear the terms mentorship, mentorship networks, not really, some people get a vision of like you're standing there beside somebody holding their hand, walking them through the work that they do. But this sounds, it's more on a kind of a systems level or a higher level where you're not, are you working with individual clinicians or are you building programs and systems and things like that?
Great question. And so what we are ultimately is we're building the mentorship networks are a program. And the
Okay.
program engages clinicians. And so you're right. When we think of mentorship, we think of that classical idea, right? That sort of original Greek description of a mentor, right? Where you have someone with an experience and a knowledge guiding someone who's fresh or
Mhm.
joining into that career or that domain, right? Helping them be a guide. And so we're building on that concept, but actually expanding it, right? Because if you really start to open up the idea of mentorship, we understand that that's one form, but there's actually many different forms of mentorship, right? And so there are mentorship forms that we think of as peer mentorship, right? So there isn't that hierarchical difference in knowledge and experience, but we're kind of navigating things together. There's mentorship where you have maybe multiple people, multiple mentors, and multiple mentees interacting together. And that's what these networks really at the heart of it, that's what they are, right? It's not about employing one form of mentorship, but it's giving clinicians the opportunity to come and participate and be exposed or engage with many different types of mentorship, whatever ones they like, whatever ones fits them, so that they can learn and improve their skill sets in terms of how they support people living with pain. Right. So, and again, when we say skill sets, what do I mean? It's the knowledge they may need to have. It's the confidence about how they can more effectively support. And it's behaviors. And like the behaviors we really focus on are really that whole person consideration, that compassionate engagement, right? Like what does it look like to engage in a compassionate fashion and set the environment for a person coming to you seeking support? How do you build that environment appropriately? So these are the types of conversations and educational pieces that are sort of really employed in that mentorship space.
I think this is amazing. I'm very
Mhm.
familiar with AMN here in Nova Scotia, and I've been involved with them for quite some time on the advisory committee and see that. And someone also involved with peer support. I like that whether it's peers or groups and multiple different ways of mentorship. And I never thought of that before. But I'm curious, and we talked about digital health. So how do these tie together? I'm a
Mhm.
little lost here. How does this all come together?
So one way I'll take that question, Virginia, is that when part of my work was sort of really characterizing, so we can think about mentorship in form. So we just talked about peer, group, one-to-one mentorship, and that's the form, right? But the other thing that becomes a different piece is the environment. So where do we meet to engage? How do we meet to engage? The classical story is I meet you in a room or you come to my house, I go to your house, we meet at a coffee shop, right? That is that in-person engagement. But the digital platforms that are available to us now have exploded where we can meet to engage in mentorship. So mentorship doesn't need to happen in person together in a room, but mentorship can happen on a video conferencing call. Mentorship can happen on a telephone call. Mentorship can happen on a text message or a messaging platform. So the digital introduction, especially in the early 2000s, exploded how mentorship can happen, not only in terms of the environments, but then here's the other interesting thing is historically mentorship had to happen synchronously. You had to be together in the room at the same time to have a mentorship dialogue. But now with the digital platforms, you can have asynchronous dialogues. I can message you at 1 a.m, but you respond to me when you're available, which might be 5 hours, 8 hours after that. So that's how digital is
Mhm.
reshaped mentorship, right? It has opened up how we can engage with mentorship in a much more accessible fashion.
That's really such a fascinating way to explain it. And in fact, sidebar, the three of us were talking
Mhm.
about how we message each other at different times because we all live in different time zones. Keith is in
Yeah.
BC, I'm in Ontario, Virginia, and
Mhm.
Nova Scotia. And so we were just chatting about that. But taking that into the mentorship frame as you have is really fascinating. And I also want to pull back on something that you were saying earlier in terms of the peer versus group. And bringing knowledge, confidence, and behavioral considerations to the discussion. And would I be correct in saying that this probably varies from one clinician to another based on their education, where they were educated, what process they went through, and so on? So, how fascinating is that to kind of almost, would this be a way of leveling the playing field in terms of understanding of that whole person perspective, the biopsychosocial, and so on? So, can you comment on that?
Well, I think that's it. And in some ways, what we're trying to do is raise everyone up to a bar, right? So, when we think about our mentorship programs, we engage people living with pain, we engage system leaders, we engage educational experts to help us identify, what are the things that we should be trying to raise the bar around? What are the domains? What are those competencies, if you want to say, for lack of a better word or a different word? So what are the competencies as a clinician you should possess or you would want to possess in this area? And so each network sets that bar. We do have a national pieces there, but each network ultimately sets the bar based on what's locally relevant and locally appropriate. And then that's what we as a program try to drive towards. And that's what the mentors try to drive towards. So when we pick topics that we want to talk about, sessions that we're going to have, speakers that are going to come in, it's all driven towards trying to raise the bar to that level.
So this is very fascinating. And so first of all, I just, not knowing about sort of the digital health and these technologies, again, tying it back to the action plan, I think it beautifully aligns with goal 4, which in part talks about catalyzing innovation and results in the translation of knowledge. What I think just a perfect fit to that. Next, I have a question for you. So, not being a healthcare provider or a doctor, we see on TV and we hear the stories about when they go through your education and training, and there's these like horribly long 3 hours of times in residency and not sleeping and all that. This feels like a shift to more like humanizing healthcare education. And are you seeing, and I think I know the answer to this, but I'm going to ask you because you're the expert. Are you seeing this movement now with the newer generation of healthcare providers who are looking for this type of connection instead of that more didactic, here's what you're going to learn, just do it, as compared to this interactive learning?
Great question, Keith. I think that's that human centricity, right? There's this humanistic approach to learning is, I think, at the core of what we're trying to do. So, part of a foundational tenet of the, and more specifically, when I say mentorship networks, what I'm describing to you are not all, but I'm talking about adaptive mentorship networks, right? That have certain components to it. So one part of an adaptive mentorship network is that adaptability in form and environment that we just talked about. But another part of it is, and this is a core, and I call it like this is the secret sauce, if you want to say, for the program. It's about compassionate spaces, right? So as much as we think about compassion for our patients, well, what about compassionate space for the provider?
Yes,
for the clinician, right? Like, where's the space for them to experience that compassion in how they learn, in what they learn, in how they skill themselves up? So how do we create that space for them? And we, when we see that, especially relevant in this time, right? We are in the midst of a health workforce crisis. And some of the foundational pieces of that crisis are burnout, right? Complexity. Clinicians are burning out because of those pieces and leaving. And when they leave, we're only damaging access, right? We're worsening access for all of us. For all of us, it's being affected, right? So the interesting thing with the mentorship spaces that we found is that when you build these kind of networks that are focused on that psychological safety, compassionate spaces, it's very curious that it not only supports more effective movement of knowledge and confidence and behavioral changes. Here's the interesting piece. It also has an impact on the well-being of the people participating. So people participating report, I feel more connected to my colleagues. I have more interprofessional connections, right? I don't feel like I'm an island unto myself. Their burnout scores actually improve, right? So they're not burning out nearly as much. So creating these communities, and that's what mentorship networks are. They're learning communities with a compassionate infrastructure there, right? That really creates a space for people to come, share, and learn together. And the hope not just the hope, what we're seeing from the evaluations that we've been running with these networks is it does have an impact on how people engage with patients and people living with pain, right? It does change how they interact. It changes how they view those interactions, and it changes the experience of the interactions on both sides.
Gosh, that's powerful.
Yeah, it is. I'm quite impressed. And you talk about, and I kind of like the elephant in the room here, the humanistic approach. And I see these in these mentorships. And I see by having the opportunity to actually join some of their stuff because I'm a patient advisor and being able to enter them, which is really, really amazing seeing the work that they do and the conversations. Are you concerned, and maybe I'm a little bit old school, because even with our peer support groups, I was a little concerned at first when we went virtual, are we going to lose that? And you're talking about digital platforms. Has that crossed your mind at all that are we going to lose that? Or are we going to build on that?
I think it's an excellent question. There's a lot of work that's being done to sort of really think about digital platforms and in what ways can they mimic or enable that community formation, right? And I think ultimately digital platforms can enable it. They enable it in a different way. It takes more time for people to come together and to feel that sense of connection and trust, right? It's a lot about trust. It's if you trust you trust the people in the room, you trust your colleagues in the room to share some of the hard things you're going through or the hard things you're experiencing, right? Because there isn't a level of moral injury that happens when, as a clinician, you want to help that person in front of you, but you don't have the tools to make that change, and you leave that encounter with that injury, right? That doesn't leave you feeling great when you leave that encounter, right? And so where is that space that you might be able to sort of say, like, I don't know what to do, and I feel miserable about this, and what can I do, right? So that kind of dialogue is really sits at the heart of a lot of mentorship pieces. And it can happen. It can happen in digital spaces. It just takes more time to build the trust to get there. And it requires, from a program perspective, to be more intentional about how you build that trust. So we spend a lot of the time building that sort of skill set in our mentors to help build that trust and that focus on community.
This has been amazing, and why I love doing this podcast is because I always just learn so much about things I don't know anything about, and this has been just amazing. And what I'm hearing, we talk a lot about from this side of healthcare, those that are whatever you want, consumers or users, people who live with pain. We talk about the challenges with a lot of healthcare providers, and we see some of that sort of dismissiveness, and I think not in all cases, but I think maybe even often that comes from as a doc, I just don't know what to do. And they're there. I mean, they're there to help people. That's your profession. And so when they've lost that path forward, I don't know what to do. Provide them opportunities to learn compassion for themselves. We talk about humanizing or humanity in healthcare. We don't provide healthcare providers enough of that education. We don't provide them any training in chronic pain, really. We don't provide them any education about being kind to themselves and humanizing what they do. And that sometimes you don't have all the answers, but here's the things that you can do. And I think it sets them up sometimes for these challenging interactions where they're just lost. And so to have these mentors and these opportunities to learn it can only benefit everybody.
If I could just add to that as well, what I find so incredibly powerful about learning about this is reminding our audience about the human aspect of that side of the table, if I want to call it that, clinicians, practitioners who are doing their darndest to, like you said, Arun, like do the best for the person in front of them. And just the fact that it's a wonderful reminder, or perhaps first time knowledge for some, is that compassionate spaces for practitioners, how critical that is, and that they are human too, or you and your colleagues, and not that I ever thought you weren't human, Arun, ever. You're a great guy. I'm really so blown away with what you're describing here. I just think it's such a powerful, it's powerful information and so critical for people to understand.
Yeah, I think, we talk about digital platforms, and I mean, it's happening. Whether we like it or not, AI is there, it is happening. So I think it's the time to embrace it. And I kind of like how that you're moving it forward, you're embracing it, and mentorship is there. and you're just kind of bringing it all together and really elevating it. And, are you getting everybody on board with this? Because I'm sure there's a lot of people are going to be a little hesitant with digital health and with this sort of a platform.
Great question there, Virginia. Yes. Do we get everybody on board? No. But I think of this as a bit of there's almost like a force multiplier, a leak effect. You get some people. And what we have found is that the people who do join, when they go back out, they influence the people that they're connected to.
Kind of like early adopters, right?
Exactly, right? So it's not limited to the people that are in the program, but they have an effect on the people around them. So there is that sort of, effect that emanates out from the program beyond its boundaries. It's a little harder to measure, but we hope and we believe that will have a ripple effect through the system.
How do you measure these outcomes? Like you're going to have to, inevitably, you have to, is it working? Is it not working? I see it accessible really geographically. We have a lot of rural areas being very helpful, but how will you ever measure something like this?
This is so hard. This is a really difficult thing to measure. What I'll say is that, right now, a lot of our measurement is depending on the people that are in the programs and how they're reporting the behavior and the changes that they're seeing themselves. We are in the process of now reaching out to people whose lives have been affected, right? People living with pain whose lives have been affected and getting their perspectives and their stories as well. But it's a really hard thing to measure. I think, as our digital tools expand, there will be more opportunities to measure this more effectively. But, the measurement's limited. It's not perfect.
It's more anecdotal or qualitative in nature, I would suppose.
There is some quantitative pieces around people sort of talking about the impact and effect. And when we have this many networks, we can start to say, because again, there are roughly some 600 mentees participating in this across the country, right? Some 70 mentors across the country, 600 plus mentees. So there is some sizable amounts of data that are coming out at this point in time.
That's impressive.
This is amazing. And I just, I love it. It supports one of my soapbox and my biases that pain is complex. Like pain itself is complex because human beings are complex. When you break your arm, it hurts most of the time. I broke my collarbone as a kid. It hurt. It got better in a way I went. When you go into this chronicity, it's very complex. And so to provide that support and education to people who are helping and supporting and treating people with pain, that they understand it's complex. It's not black and white, that there's a person involved. All of this is something we talk a lot about that is needed. And to sort of hear that it's happening and the fact these digital technologies are really supporting and enhancing that. So I didn't know how these two were going to come together. This has been incredible. And I've learned just so much. And I didn't realize how much of this was happening. And I'm so glad to hear that healthcare providers are being given this kind of knowledge and education.
I know we're just scratching the surface because we talked a lot about digital in the context of mentorship, but there's so much opportunity, I think, in the future around, Virginia, to your point, AI and what it can do for people living with pain. And that is a whole other conversation.
And it just makes me so happy to know that we can play a small part in conveying the message about everything you've told us today.
Yeah.
It really makes me feel very good about that. Thank you.
So we'd like to thank you for being here with us today and really for sharing your time, your expertise. This has been a very intriguing conversation and quite unique from other ones we have had. So it's been really impressive. And to see taking something that I can see as very complex and trying to move it forward. So thank you for doing what you're doing and being here and sharing with us.
Yeah, it's fantastic. And we'd also like to thank all of you for tuning in to the Action on Pain podcast. We hope this incredible episode has shed some light on the important work being done in Canada as guided by Health Canada's Action Plan for Pain in Canada. Until next time.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.